Hello guys, thanks for taking time to watch this video. The disease that I chose to do was a cardiac disease, and that disease is congestive heart failure. So I'm going to just give a little background of what congestive heart failure is, and that's when the heart can't pump enough oxygen and blood that the body needs. So this doesn't mean that the heart has wholly failed, it just means that the heart muscles have become weaker, so it can't do its job it's as good as it's supposed to. So the heart can't keep up with pumping the blood throughout the body. So when the blood is being pumped throughout the body, it returns to the heart faster than it's being put out. So due to the heart being unable to pump the correct adequate amount, this will result in decreased cardiac output. Decreased cardiac output is what happens is it causes the blood volume in the vascular system to increase. When this happens, this causes congestion in the veins in the body, which then disrupts the body fluid flow, resulting in buildup of fluid in the tissues, which is also known as edema. So I have a couple of diagrams that I wanted to show. So this is the first diagram. And you can see this is a normal heart, and this is a heart with heart failure. Oxygen blood, rich blood is pumping through the body, through the left ventricle. So you can see here, here's the septum. Heart failure. You can see that the ventricle here is more dilated versus here, which having a dilated ventricle reduces the volume that's being put out. I have another diagram here I'd like to share. This shows a normal heart and a heart with heart failure. So here's the normal one. Here's the one with heart failure. So here you can see that the heart muscle is thick, really thick, as you can see. And then here it's not as thick on a normal heart. So that just kind of gives you an idea here. So here's this diagram. And then here's the other one that I showed again. I'll give you another idea. All right. So continuing on with what I was saying, on to the primary cause of congestive heart failure is having a weakened heart muscle. So there are many things that can contribute to having a weak heart muscle, such as having arrhythmias, abnormal heart rhythm, having any types of heart valve diseases. Heart attacks can add to a weakened heart muscle. Having any types of congenital heart diseases, high blood pressure, coronary artery disease, which is thickening and narrowing of the coronary arteries. Now, when it comes to how congestive heart failure is diagnosed, there are many different assessments that have to be done. It's a process. So there are things such as an ECG, which is known as electrocardiogram. This records the electrical signal from the heart while resting and exercising. Something else that could be done is a stress test. It's a cardiac stress test, which measures the heart's ability to respond to exercise-induced stress. So a stress test records your heart and tells them how your heart does while exercising, and your heart's getting, having to work harder while you're exercising. So that tells them that. Another thing would be an echocardiogram, which is an ultrasound that would be done of the heart. A CT scan, computed tomography, is a scan that could be done of the heart that can show anywhere from plaque buildup in the arteries It just depends what exactly they might be looking for, but it'll let them know and give them different views of your heart. Another thing that could be done would be an MRI scan, which is magnetic resonance imaging. That can show detailed images of the beating nature of the heart, and it can show the doctors the structure and how your heart is functioning. Other testing that could also be done, a PET scan, which is a positron emission tomography test, or even a biopsy. A biopsy could be done. It just depends what they find out from all the other assessments ahead of that. So when we come to talking about what causes congestive heart failure. So congestive heart failure can be caused by many different things. Like we talked about before, having a weakened heart muscle. So having muscle loss or excessive or insufficient pressure or volume. So if your heart has any type of muscle weakness or damage, this will obviously, or it can obviously cause the heart not to work at 100% like it should. Having these issues can cause the heart to lack cardiac output, which means it's not pumping enough oxygen and blood throughout the body. Reasons for this would be a decrease in muscle contraction, which means the muscle isn't contracting as it normally should. Another thing that can happen is that the atrial pressure is increased, so this can cause pulmonary congestion, which means it's a buildup of fluids in the lungs, which can, if there's fluid in your lungs, that can cause difficulties breathing. An increase in vascular resistance can take place, which means that the cardiac output can be reduced. All of this can cause increased heart size, which is commonly seen with congestive heart failure due to increased wall tension from the increased myocardial oxygen consumption. So another thing assessment that could be done for this is a chest x-ray. This can show the heart. Sometimes they can tell if it's a larger heart than normal, or that can give them a look also. So in the world, about 64.3 million people are learning how to live with heart failure. So statistics say for every 1,000 people above the age of 65, 10 people end up having congestive heart failure. Now, between the ages of 60 and 69 years old, more than 5% of people have congestive heart failure. Congestive heart failure affects both men and women equally. So the risk factors there, it doesn't affect one gender more than the other. African Americans are apparently 1.5 times more likely to develop heart failure than Caucasians. When discussing the economic impact of chronic heart failure in our economy, chronic heart failure consumes about 1 to 2% of the total healthcare resources in well-developed countries. Congestive heart failure can affect young children, young adults, middle-aged people, and even the elderly. So there isn't a specific age range that congestive heart failure targets. Congestive heart failure is often heard as it affects older adults along with the elderly, but that's not always the case. It can happen to anybody. It just depends on what kind of heart issues they have going on and whatnot. So there are 1.4 million people that are under the age of 60 that are affected by congestive heart failure. More than 5% of people aged from 60 to 69 have it. From ages 40 to 59 years old, it's a less percentage, which is 2% of the people are diagnosed with congestive heart failure. So I guess it seems that way that older people, there's more percentage of older people above the age 60 or 65 that have it. So the CDC stated that most of the hospitalizations with congestive heart failure were for ages 65 years old and over. But apparently the percentage of 65 and under had increased from 23% in 2000 to 29% in 2010. So as we know, it affects people of older ages, but as the years go by, it seems to be affecting the younger population a little bit more and more. So when it comes to talking about prevention and ways to prevent getting congestive heart failure, although it doesn't necessarily mean it will prevent it, but these are things that you can take into factor. So secondhand smoke and smoking are huge risk factors because they can cause arterial damage in the heart, which can obviously cause heart failure and heart weakening. Eating healthy is good all around. That can, it's obviously just eating healthy isn't going to prevent you from having any heart issues, but it's good for your heart. Eating low sugar and low sodium foods, good fats, lean proteins, eating hearty meals will help all around in the long run. Not being obese is another thing that can help. Being physically active every day is good for your heart. Being obese means that your heart is working harder to keep up with your body's needs. So being physically active is great because it'll get your heart pumping and your heart working. Another way to prevent congestive heart failure is taking care of yourself, having ongoing medical care and treatment, going to your doctor's appointments and getting checked up, having your yearly labs done, checkups with your doctor, staying on top of your health, and getting ahead of the problems before they're too bad. Managing and treating any ongoing medical conditions that you may have or may be getting will help prevent, any condition or your health from getting worse and turning into something more. Good health promotion strategies would be ways to prevent congestive heart failure from being developed. Educating people on what congestive heart failure is and all the things that it can cause. If someone has it or are on their way to, close to having it, having support from family and friends, or maybe being a part of support groups from other people diagnosed with congestive heart failure. Just having that outlet, extra help, even if it's just somebody to talk to. A good health promotion would be educating our youth to be aware of the disease and ways to prevent it at a younger age, so that way they can get ahead of it before it's too late and start, taking care of themselves at an earlier age. I feel like people, when they're younger, they don't think of things like this. So if we promoted good health and showed our younger youth what it could turn into, I think that'd be another way. So in the last decade, digoxin therapy has been looked over due to its neurohormonal effect. In trials, it's shown a reduced morbidity rate. It's a positive in congestive heart failure patients because it improves the patient's symptoms and reduces the number of hospitalizations. So by doing that, it enhances the patient's quality of life overall with congestive heart failure. Not exactly treats it, but it improves the symptoms and everything else. Thanks for watching.